quality of life, pain over time. Okay, and if someone wants to interrupt at any time, please feel free to do that. If you have a question or comment or disagreement. Okay, so we mentioned that post-herpetic neuralgia, a universal definition is lacking. Some people would define it when the lesions disappear. Others would say a month after the lesions, others 3 months, and so forth. So, so you need to know about the timing of the acute phase, when the lesions broke out. You need to be aware of this zoster-associated pain. Now, there's a circumstance where somebody can have acute zoster and go into post-herpetic neuralgia, and they don't have the rash or the vesicles develop. And that's what we call a special circumstance of zoster sine herpeticum. So this is hard to diagnose. You have to have a high degree of suspicion, and then the way you diagnose it is by antibody levels. You do blood tests, and you look to see what the antibody levels are for zoster, and these can be measured. And if it's out of control, way up out of normal, then it is likely that a patient who has radicular symptoms, severe pain, and the workup so far is negative, then you can surmise that he probably or she probably has had zoster sine herpeticum with post-herpetic neuralgia. So I've had one case like this in 10 years, and a patient who had breast cancer and came in with thoracic pain and had a workup which was negative for any tumor or any thoracic anatomical explanation. And we did this, and I said, you know, she has cancer, she might have zoster sine herpeticum. We did the titers for zoster, and they were off the scale. And so we just made a presumptive diagnosis of what it was, and we went ahead to treat her with that. Okay, next please. Next please, thank you. So typically you can recognize zoster by the vesicles, by the history, but just remember that zoster sine herpeticum might occur, and you have to have a high degree of suspicion about it. Next please. All right. What are predictors of post-herpetic neuralgia? Who's going to get post-herpetic neuralgia? Well, we saw age is a determinant. So patients who get to 85 years of age and develop acute shingles will have reports of post-herpetic neuralgia. And the severity of the zoster during the onset is said to be predictive. If the prodromal pain is severe, that is the pain prior to the outbreak of the vesicles is severe, if the rash is extensive and very severe, and if the pain during the rash is very severe, these are said to be predictors of those who are more likely to have post-herpetic neuralgia than those who don't. Also, during the acute phase, you can get viremia, and the extent of viremia is correlated with the degree of post-herpetic neuralgia. Now, there are psychosocial contributions to determining who will develop post-herpetic neuralgia, and I'm going to leave this for Dr. Strata to explain, because quite frankly I don't understand it all that well. But coping abilities, the manner in which people deal with pain and how successful they are in dealing with pain helps to predict who is more likely to develop post-herpetic neuralgia and who won't. So these are some of the predictors of the pain syndrome post-herpetic neuralgia. Next, please.
Can I ask?
Yeah.
So I have a sense of why that would be. How do you actually get it? Is it a virus?
Oh, yeah, I'm sorry.
Okay.
Zoster, sure. Zoster is chickenpox virus. It is believed that after you have chickenpox in childhood, the virus sits dormant in the central nervous system, in the dorsal horn ganglion near the central nervous system. And then for what is believed to occur is that as we get older, our immunocompetence decreases. So while the virus is kept in check by immunocompetence, as that decreases with age, the virus is then allowed to break through and replicate. And so it's the replication of chickenpox virus that you got when you were a kid that's been sitting around for decades, and now it replicates and starts to develop.
So you can only get it if you have chickenpox?
That is the theory, yes. You have to have had exposure to chickenpox at some point. And then it sits in your nervous system, and then it starts to break out again after your immune competence decreases and your responses aren't able to keep the virus in check.
So that also would mean that for people with HIV or maybe cancer-related immunosuppressant, the risk is higher?
That is correct. That is absolutely correct. So you see it in immunocompromised individuals, as you mentioned. It seems to be a greater risk for that as well, for the acute infection. Any other questions?
What is viremia?
Oh, viremia is the virus in the blood. Like bacteremia is bacteria in the blood, viremia is virus in the blood. So when you get a breakout and it gets absorbed into the bloodstream and sent around the body, so that's what it means. Anything else? Okay.
With chickenpox vaccine now that kids get, they don't actually get chickenpox. Is there any thoughts in regards to that would maybe decrease incidence of post-herpetic neuralgia?
Yeah, that's been raised, and the question is, if people don't get the natural chickenpox, is that going to affect the incidence of shingles and post-herpetic neuralgia later on? I don't think anybody has that answer yet. It hasn't been enough years. But that's been raised as a question. You're absolutely right. Okay. Anything else? Okay, next. So the significance of post-herpetic neuralgia is the pain that is debilitating. The pain that increases as a person gets older. And it's also a healthcare issue as our population is aging. You're going to have more individuals with this condition because an older population, the percentage of that population is going to develop this. So there are going to be more people having it, and there's going to be more healthcare dollars needed to address this. Go ahead. And this is the distribution of occurrence of zoster. The thoracic region is where it occurs or manifests most often, and in the cervical brachial area next, in the sacral area is third, and the cranial area ties for the lower extremity, and the incidence in the lumbar and sacral area. Okay.